On the heels of a long, harsh winter, life comes back to Alaska.
This is a great time of year in Alaska because spring has sprung. We're getting all the little willows popping out, lots of, the greenery's poking through, and babies are here.
Are you hungry? Come on. There she is. There's a good girl. Come on. I'm Lauren at the Williams Reindeer Farm in Palmer, Alaska. Today, Dr. Oakley's coming out to help check on some baby reindeer for us.
Hey.
Hi.
How's it going?
Good.
Good to see you.
Yeah, good to see you too. This is an exciting time at the reindeer farm because we have lots of baby reindeer being born. We've had 25 born so far, and we're expecting 40 babies.
Okay.
On the docket today, the morning field check to see if any babies were born overnight and make sure everyone is looking healthy.
Hi, kids.
This is gonna be awesome. I'm getting to do basically Santa's job. I'm like, scoping out what's the new talent coming up this year, the new crop of baby reindeer. So it's very fun to look at the babies, make sure they're healthy, of course, but just to see them running around with their moms, it's pretty entertaining.
But there's so many of them out
That one
here.
is so blonde. She's like two-tone.
Yeah.
What do you call that when you do your hair with a lighter at the end?
The ombre.
Ombre.
Yeah.
That's what she is. And I got a good look at everybody.
Okay, cool.
Okay,
No
we can
babies
start.
born last night, but a special treat was discovered during yesterday's check.
Aw, you're so tiny.
Hi, babe.
Lauren has one that was just born a little less than 24 hours ago. Hi. Hi, Mama. So that one's definitely needing an ear tag. We're gonna weigh it.
Oh, look at that fuzzy ear. So cute. 2, 3. Good boy, I know.
Sorry. We wanna see how much you weigh. What are our bets here?
A weigh-in will confirm if this little guy is growing as he should.
Oh, I think more than
12.
that.
Really?
I think 13. I'm going 13.5.
Okay.
Okay, we're gonna pick him up. There. 15 pounds,
Whoa.
12 ounces.
Whoa.
Oh,
Oh, my.
As we lift him, the sling just breaks. So, he's in great shape. There's nothing wrong with this calf, and he's one of the bigger ones.
that's a big boy.
That's a very
That's
big
the
boy.
biggest boy I think we've had this year.
You did great.
Okay, did you want to try and milk this mama?
Yeah.
Along with a newborn calf comes the mother's nutrient-packed first milk, called colostrum.
So the mom just had this new baby about 20 hours ago. So she should still be making some colostrum, possibly. It kind of depends on how much he's nursed. So he probably got some of it, but we were gonna take a little bit of extra in case there's another baby that's born that the mom doesn't look after, then we can give it the colostrum from her. That colostrum is kind of like liquid gold because it has all the antibodies in it. It has all the kind of really important things to help that baby fight any infection. There we go, look at that.
You got it?
Yeah, now it's flowing.
Do you
Now
think
I
it's
bet
colostrum or is it more milk?
it's definitely looking milkier. You know how the
Yeah.
colostrum's really pale?
Uh-huh.
So it turns out what we milked out of this mama is not colostrum. She must have been just past the mark because it wasn't the right color. It's a little bit whiter and just more like regular milk. So that means it's up for grabs. That is good.
Yeah? It's like creamy.
You're like, it is super creamy. Yeah, it tastes really good. Almost like unsweetened, or not very sweet whipped cream. There is an aftertaste. There's definitely like a Christmassy aftertaste.
Oh, good.
You're cute. Yes, you are.
A new day, and Michelle's back on the road to check on a rescued moose.
Today we're at the Alaska Wildlife Conservation Center, and we're going to be working on the moose named Clark. Clark has had an on and off respiratory issue. It started about 10 months ago. Him and another moose named Denali, they're about 3 years old, they both started with a cough, then they started with a lot of drainage from their nose, and then they were blowing chunks. They were coughing up yucky, mucusy pus. So they were really quite sick. Oh, it sounds like you're trying to breathe through a bag of mucus.
After several treatments, Denali continued to go downhill.
Gosh, you're a sick puppy. He lost a lot of weight, and then it became obvious that his quality of life was very poor. So we made the really hard decision to put him down.
Now, all eyes are on Clark.
Clark, he was actually never as bad as Denali, but then he's continued to have this bit of a drippy nose and a cough for a while.
Today, Michelle's back to make sure he doesn't suffer the same fate as his penmate. Along to help, veterinary pathologist Dr. Kathy Burek, who performed Denali's autopsy.
So what we found on Denali is that his lungs were in very bad shape. A lot of the lungs were atelectatic, which means they were collapsed, and there were multiple abscesses in the lungs.
He's definitely not as thin as Denali, for sure.
The team will collect blood and examine Clark to compare his symptoms to Denali's.
Can I go in there?
Yeah.
He's not gonna charge me, is he?
I'll bring some, like a piece of brow so he doesn't
Okay.
eat too much. I can put it in that corner and then you can come
Okay.
in over here.
All right.
Getting hands-on with a 400-pound animal, especially this one, will require anesthesia.
Whoa.
Kicking, no kicking.
He doesn't like me.
Out of all the bull moose currently at AWCC, Clark is the most stubborn moose we have. He certainly holds grudges, and if you're new, he definitely picks on people.
Look at how angry he is, Sarah. What have you been doing to him? He's mad.
It's my blue coat.
Okay, get ready to run.
A direct hit.
Yeah, he's mad. So right hind at, I don't know what time it is.
He's looking like he's practically sleeping on his feet, huh?
Yeah.
Within minutes, the anesthesia kicks in.
He's droopy.
Yeah.
There he goes. He's down.
Good boy.
Where's that blindfold at? Just wait a second. The first thing I do actually is, once he has a blindfold on, I pull out his tongue and that opens his airway, and then I can see his color and I can check to make sure that it's nice and pink and that the refill is quick.
A nasal tube supplies Clark with enough oxygen to support him throughout the procedure.
When they get so out under the anesthesia, their oxygen drops really low and they can almost be like so low that they would pass out. But we wouldn't notice it because they're under anesthesia. So the oxygen's really important to make their recovery better and to keep them safe. So you guys can come in and want to have listen to his chest and stuff? Okay.
If Clark's lungs are healthy, Michelle should hear the sound of flowing air. If not, he could be heading down the same deadly path as Denali.
His lungs are kind of quiet, especially down low. As I'm examining Clark, I'm listening to his lungs. On the left side, I'm hearing very little air movement. Can I try that one? I've switched stethoscopes, and I'm like straining and like desperately hoping I can hear things like, okay, it must just be my ears. And then I go over on the right side, no, yeah, I hear the movement of the air. I can hear normal lung sounds. There's a big difference right to left.
His respiratory rate is coming down.
Yeah, what's his heart rate?
37.
Have a listen, see what you think, and I'll start getting blood samples.
Yep.
We learned on the last moose that the lungs were so bad, they were so collapsed and adhesed, and they were full of abscesses, and that we couldn't see that, but we could hear something didn't sound right. And no treatment that we could do was gonna save Denali. But for this guy, we're kind of wondering the same thing. Like, he might not be as bad, but if his lungs are that bad, he will continue to go downhill.
I was hearing nothing down the left cranial.
Dang it.
Dr. Burek confirms. Clark's left lung may have already collapsed.
I was hoping I was wrong.
Time is running out.
Do you want to just hand me the other 20 ml syringe, Tracy, and you can just pop the tops off? We need to get as many samples as we can and send the sample to several different labs. Here's another one that's ready. It's great to get Dr. Burek here today. I mean, not only can she give us all her expertise here in the field, but she can take the samples back and make sure they're properly handled, and that she's gonna look microscopically to try and see the problem. There's all different kinds of things that she can do that can try and identify exactly what type of disease process is at play. So we can tailor our treatment and hopefully save Clark. Do you need any more?
I think we're gonna be okay.
Awesome.
To give Clark every advantage possible, Michelle administers vaccinations and an antibiotic.
Tracy, the vaccine's going left hind low.
Okay.
We're giving him a vaccine for clostridial diseases, which is a nasty bacteria that can cause tetanus. I'm gonna give him a selenium injection because they have been low in selenium, vitamin E selenium. He's also getting a dewormer. Okay, I think we're ready to reverse. I mean, everyone can scoot.
Should we get this?
One final injection will counteract Clark's anesthesia, so he can safely regain consciousness.
Knowing how we just couldn't save Denali, we're definitely all on edge. Okie dokie, there we go. We're finding that, similar results on both of the animal samples, then we might have to consider putting him down.
A medical mystery has already claimed the life of one moose. Now, Clark is showing the same deadly signs.
Oh, there he goes. He's just moving his head, pulling his tongue back in his mouth. He's got his head up now, which is really nice. Awesome. So he should be up in about 20 minutes to half hour.
As the effects of his anesthesia wear off, it's a race to find the root cause.
So I guess we'll get those samples off from Clark, and then we'll wait to hear from you.
Sounds good.
Results will start pouring in.
Yes, yeah. My biggest concern with Clark is just to figure out what's really going on. He's still coughing, he's still got nasal discharge. So unfortunately, it's just not looking good for him.
Back home, Michelle is prepping her clinic for the arrival of an old friend.
So we're getting ready for Archer to come in. It's a big day for him and for everybody. Archer is finally ready for one of his, well, hopefully it's his final surgery.
4 months ago, Archer, a 4-year-old greyhound mix, was severely injured in a tragic house fire. Roughly half his body was covered in third-degree burns.
Oh, Archer.
Determined to save his life, Dr. Oakley enlisted the help of veterinary burn specialist Dr. Jamie Payton and a revolutionary burn treatment involving fish skins.
I mean, the coolest.
It is definitely the coolest.
The results were nothing short of miraculous.
Look at him go. The good news is that his healing has been phenomenal. Let's back up a step. The good news is that Archer is still alive and doing really well. He's like surmounted infections. I mean, all the critical stages of a serious burn from the beginning. And his healing has been amazing. There he is, the man of the hour. Come here, Archer, you're a good boy.
Today, Archer's back with his owner, Cody Fisher, for a problem that's emerged during the healing process.
Basically, the skin on his head is healed, like in terms of the burn tissue is healed, but part of healing is for the skin to kind of pull itself closed. When it does that, it just pulled his eye wide open and he can't blink it anymore. And that's making it painful for him, and we're gonna fix that.
Not just painful, it leaves Archer's cornea completely exposed, vulnerable to serious injury and infection.
Good boy, Archer.
To help bring Archer much-needed relief and save his eye, Michelle once again calls in the experts.
We have assembled a team of the finest.
Looks like it.
Yes, of course we met Dr. Payton and Dr. Johnson
You too.
from the vet
Good to see you
school.
again, Cody.
When I first had the issues with Archer, I reached out to Dr. Payton, and I mean, we basically assembled this dream team to do his initial surgery and put fish skin on him. This time, if we could even have a better dream team, we've got Dr. Tina Palmieri. She's actually a human burn specialist, like surgical specialist. Yeah, so we're getting the best.
Alrighty. We've kind of gotten over the few big speed bumps, and we're kind of in the home stretch here.
Okay.
You guys.
See ya. See you in a bit. Good boy. Okay, oh, Archer.
Okay.
Archer's getting top of the line treatment with all the best people, so I got quite a bit of confidence that he's going to be back at full speed here in the next month or two, I think.
Should we get started?
Let's go.
All right. All your stuff off.
Michelle's priority today will be monitoring Archer's anesthesia.
Most of the surgeries I do here in this clinic are quite short, but we have a big procedure today for Archer. You know, it's basically plastic surgery. So we're gonna have to have some pretty good meds and some sedation to keep him down.
She will deliver the anesthesia in multiple steps.
No.
First, an injectable sedative, one that's new for Archer.
Sometimes the sedation in particular can cause a little bit of excitement, but let's see how he does. Good boy. It's okay.
Oops, sorry, buddy.
Things look weird, don't they? It's okay, buddy. It's a different one than we've used before, huh? It's a little funny. So we gave him his pre-med, like his bit of sedation.
You're okay, Archie.
And he's going through a bit of an excitement phase. It looks like he's worked up, but it's really just a physiological reaction to this drug in particular.
Okay, you're okay.
It's not dangerous for him. It's actually one of the safest drugs we can use.
You are gonna get the best sleepy medicine ever.
But what we can do for that is just hold him, calm him, you know, reassure him until we can get a catheter in. And then the next step of sedation drugs will just take all that excitement away, and then we can get started on the procedure.
Yeah, we'll clean it up later.
So we're about to put our masks on, scrub up, and start getting down to business.
There's one extra challenge for the doctors today.
Whew, is it warm in here? Our biggest issue last time with Archer, when we had the long procedure of putting on the fish skin, was how hypothermic, like how cold he kept getting.
Yeah, Michelle, he's starting to cool down. He's down to 37.5.
Oh, boy. It was scary. So this procedure today could even be longer, and we're going to need to keep the room hot. I mean, it's all about Archer, but whew.
Can we get that 15 scalpel blade?
The stage is set, and the long-awaited surgery on Archer's eyelid can finally begin.
What I'm gonna do is put what I call a stay stitch, just to hold it so it'll hold our incision still and give me something to pull.
So the surgery today is we're just going to do a cut right along, kind of above where his brow line would be.
So what we're gonna do is we're gonna actually make the incision here.
Just doing that cut is going to open up and release the tension.
But notice what's happening to the eyelid as it's going down as I'm cutting it.
Oh, Archer, I'm so excited for you, buddy.
We all have a blink reflex, which is why you don't see this a lot.
A second incision across the bottom lid will allow Archer's eye to close completely.
So now you can see, if we do this, his eyelid closes.
Nice.
Where
Look
his
at
eyelid
that.
wouldn't close at the beginning.
Love it.
I think we're good.
Oh, man. That is so nice to see his
Close.
eyes closed. I had to be super uncomfortable.
Yeah.
It's what the team's been waiting for. But this is just phase one.
Now we have this great big defect and opening there, and instead of trying to close it, we're going to take tissue from his neck and just plant it in there so that his eye can blink.
So now we need to measure.
To ensure they remove enough tissue from Archer's neck for the graft, Dr. Palmieri takes an imprint of the surgical site.
So you can see.
Oh, cute. It's
Perfect
like
imprint,
kiss.
okay?
It's like a little kiss.
That's the upper lid. And we obviously need a piece big enough for both. Make sure you've touched the whole thing.
Nice. So Dr. Palmieri measured the size of the defect, and we've drawn it out. So we're just about to take that piece of skin, cut it in half, and then plant it into the defect area. There's a lot of little tricky tricks to making a graft work. You know, just measuring the graft, understanding that when you go harvest the graft from a different part of the body, that tissue is going to shrink, knowing that you have to take all the fat and tissue, like literally have nothing left on there but skin. Oh, so you're really just taking the top layer.
just
You
the
don't
top
want
layer.
any of the
Okay.
sub-Q going with it. There's a lot of little things that you need to do to make sure that graft is going to be successful. Otherwise, it's all for nothing.
You're almost at the back end, so just connect the dots on the skin.
Like that.
Yeah.
Before the team can finish the task at hand, Michelle makes a critical discovery.
Ooh, our oxygen is almost out. Okay, I just feel like this is leaking. It's not going at all, so we need to disconnect him. Our oxygen's out.
You're almost at the back end.
It's nearing the halfway point on Archer's eye surgery when Michelle makes a discovery. The oxygen tank is malfunctioning.
Ooh, our oxygen is almost out. I just feel like this is leaking. I just looked at it like not that long ago, and it was at the 500, and then when I looked back, it was all the way done.
Under anesthesia, Archer can't regulate his own breathing. The situation is dire.
I mean, when that oxygen is out, we've got to replace it right away. It just went out. Okay, we need another tank. Not only is he not getting oxygen piped in, he's also not getting any drugs to sedate him, and he could wake up.
Is he okay? His stats are
Yeah, his stats are great. It just happened, so
The defective tank is quickly swapped out.
you see it lined up in there? Yeah, there we go. And we're back.
And we're back.
With crisis averted, it's back to business. And the final cut to harvest Archer's skin graft.
And see, we've got this, and then this piece here is just about the right length. Voila.
Woo!
And, you know, kind of looks like a dog eyelid.
It does.
Okay.
While Dr. Palmieri preps the graft, Dr. Oakley scrubs in and closes the incision on Archer's shoulder.
Archer is doing great. One of my big concerns was his body temperature, and we've done a lot of good preventative stuff that his temperature's staying nice.
But this team is starting to feel the heat.
I am sweating now. Holy.
I know. Well, that's what I say. We're focusing on patient
Archer.
comfort, not our comfort.
Yeah. Nice.
The final step, attaching the skin graft.
You start at the corner, and whenever you're sewing an eyelid graft on, you want to make sure that your knot never gets anywhere near the eye, because the knot can cause a corneal abrasion. You see how it just falls into place now?
Yeah. So Dr. Palmieri is just putting in some of the final sutures of the upper part of the first graft. Once we finish that, we're gonna start to trim it because the bottom piece of that graft is gonna be what fills in the defect on the lower eyelid.
Okay, now, this other piece, let's get this baby in there.
So what do you think about that hair going up in that direction?
That's your good point. Let's change it.
When we put the bottom graft in, the first way that we laid it, the hair was actually growing this way. It's like, we better flip that around. Not only because it, it would look kind of funny, but also because it could cause serious irritation to his eye.
That's beautiful, see?
Yes.
Nice.
Thank you, ma'am.
Nice.
That is teamwork.
Look at that. He's gonna have such cute, expressive eyebrows now.
I know. Little cuteness.
I'm just gonna pull out the stay sutures. I mean, this means Archer can close his eye. He's gonna have some swelling. There's gonna be a little recovery period, but nothing like before. And look at it. This eye wants to close now, like woohoo. When we first saw Archer, we knew he had burns all over, and we thought he would actually lose his right eye. So to think of how far we've come from that, it's been a long process, but it was so worth it, and that's been a really important kind of learning journey for me, is that success rates of these animals healing from these burns are really high. It takes a lot of work. Oh, he's starting to blink and look at me now.
We saw him when he was at his worst, and now coming back and bringing in our expert here, and all, really
Thank you, Dr. Palmieri.
It's amazing being like this whole team.
Yeah.
Burns is the team sport.
Absolutely.
Our patients deserve that.
Hey, Archer, are you waking up yet? You want to go out and play? He's never going to look exactly how he did before, but he's not going to care. Cody's not going to care. He's going to be functional. He's going to feel good. And he is a young dog. He has a great life ahead of him.
Hey, Archer. How you doing, bud?
As Archer recovers from surgery, Michelle has a backlog of patients to catch up on. She'll need to hop to it to stay on schedule.
So Luana and Dewey are coming in today, and they're bringing in one of their rabbits. His name is Fraser George. Okay, we're ready for the bunny.
Fraser George is a fun bunny. He's very stubborn because, well, since he's not neutered.
Unneutered male rabbits are notoriously aggressive. Fraser George is no exception. He's wreaking havoc at home, especially on his female bunny mate.
This is Fraser George, huh?
Yes.
Okay. Dr. Payton happened to be here helping me on some other cases, so she's gonna help out with this. I heard he's been giving you a hard time.
The thing of it is to have him respect Jenny's boundaries.
Jenny's the other rabbit, I'm afraid. Because she's spayed, right? Yeah. So she's absolutely not interested, right?
No. You bit him twice.
Oh, okay. Yeah. Intact male rabbits can be very aggressive, and they are relentless when it comes to other females in the area. So even though the female rabbit at home, Jenny, is spayed, he doesn't seem to care, so they're getting into a lot of fights.
Stamping his feet a couple times.
To make matters worse, Fraser George has started marking the wrong territory.
And I heard he was peeing on stuff, like wasn't he marking and peeing on various things?
That's the reason why I'm here to see you. He sprayed me.
Oh.
He said he gonna mark me.
Part of the reason for the hair spray is he's trying to mark his area. He's basically spraying urine on Luana.
Mom's mad.
That's another issue with intact male rabbits is they're urinating, they're marking everything. He is just a complete nightmare right now. So the solution to all that is to neuter him. It's usually done when they're younger because they do become, so difficult to have around as an older intact male. Well, Fraser, we've heard all about your antics. So we'll go ahead and get started. I'll give you a call and let you know when he's starting to wake up and let you know when you can come pick him up.
Okay.
Okay? Great. Can I scooch you out? Boop, boop, boop. What do you think, buddy?
You're a big guy.
He is big. Hi, how are ya? Okay.
Oh, you're so handsome.
We're gonna lights out here for a bit.
An injectable sedative will knock Fraser George out for the procedure.
What a trooper. Good job.
Boy.
It's a big day for you.
So once I've got the testicles cleaned off, basically all I do is a quick incision. Okay. And get the testicle out. Just gonna open this sucker up. Big boy Fraser.
But neutering a rabbit has a unique challenge.
Rabbits can suck their testicles back up into their abdomen, literally inside their belly. They have what are called inguinal canals, which kind of sit right there in their inguinal area. You're not going. No, you're not. When they do that, though, I can't get at it to do the removal. So we have to make sure that he's deep enough in anesthesia. So I'm gonna get Jamie to maybe turn up the gas a little bit because he keeps kind of pulling them up and I can't get out to do what I need to do. Up you just a bit, buddy.
Good, buddy.
Okay, so there's one gone.
I'll see.
That looks good. Okay, one down. And the one is still hanging on there. So as I go to remove the second testicle, there's number 2. It starts kind of like slipping away from my fingers. Oh, no, don't you go. Don't you dare go. Don't you go. And it's basically going, gone. Big boy Fraser.
Fraser George, the rabbit, is getting neutered in hopes of fixing his bad attitude.
One down and one to go.
But the remaining testicle is escaping Michelle's grip.
Don't you dare go. Don't you go. It starts kind of like slipping away from my fingers. And what's happening is there's a muscle attached to it called a cremaster muscle, and he can actually shorten that muscle and pull the testicle into his belly. Yeah, he's pulling that up.
Okay. We'll turn you up for a minute. Hold on.
I am holding on. I'm not letting that go back in. I didn't remove it, so I need to get that back. So I'm gonna have Jamie reach underneath, and usually just with abdominal pressure, she can actually kind of just move it forward and it'll pop back into the scrotum where I can get at it. I can feel it right there.
Yeah.
Yeah. Thank you. Yeah.
I think you might have just dropped the ball on that one.
But bumps.
Michelle quickly removes Fraser George's testicle and sutures the incision.
Closed for business. Gone fishing. It's nice to work with Dr. Jamie. We keep each other laughing. There's no shortage of bunny puns.
He's no longer a baller.
Oh, snap. It's fun to have someone to work with like that. Hello, friend. Are you ready? Are you ready to sit up? I can see why Luana likes you when you're behaving. George did awesome. He was a perfect patient. Once we got him sedated and all that, he'll be a much better bunny to have around. And I know Jenny is going to be very thankful, his other bunny friend.
Minus 2 hormone-producing testicles, Fraser George's behavior should improve over the next few weeks.
Oh, hi, Luana. How are you?
Okay.
Good. He did absolutely great. Good. You can go ahead and take him home now, but just keep an eye on him and make sure that he's eating good. And offer him water and everything right away.
That's the first thing I did was let him know that Mama's there for him and, you know, Mama's here.
Good stuff. Okay, thank you so much for coming in, Luana and Dewey. Appreciate it.
Okay.
All right.
Thank you. You know, it's done, and I can see that he doesn't seem like to be in any pain. That's a good thing.
Michelle's back on the road, heading west for a return visit to the reindeer farm.
So excited to see Denise and all the reindeer?
Yeah.
It's the end of calving season, which means a spring checkup for the entire herd. This time, Michelle's brought backup, her daughters Maya and Willow.
All the baby reindeer are gonna be running around, so it'll be pretty cute. Today we're going to do the semi-annual kind of roundup where everyone gets their vaccines, they get dewormed, and it's kind of our first chance to get our hands on them since calving, so we're gonna make sure that everybody did okay through that calving season.
Before Michelle can get her hands on the herd,
All right.
Hey!
farm owner Denise Hardy has an urgent matter needing immediate attention.
This morning we were bringing the herd up from the field. They're out on pasture every night, and this little calf is about a week old, and it's been doing great. But this morning it didn't get up and come up with its mother. It just laid there.
Okay.
That definitely has me worried. We lost a calf a couple days ago to a similar situation, so that's really concerning that it may be something that's contagious or something going through the herd. You can kind of see it in the grass over there.
Okay.
Still acting pretty lethargic.
Any diarrhea or anything? Or?
Not that I've noticed, so everything's been fine. And then today,
Just this morning,
so I'm so glad you're here.
Yeah, okay. Right, okay. We need to get on that first. That's an emergency. I mean, when calves start going downhill, they can go downhill really quickly. You did see your nurse all along?
She's been doing really good.
And the mom's been healthy and stuff?
She's a young mom, so she's 2. Her name's Juliet.
Hi,
but look
Mama.
at this poor little baby.
Oh, why? Why are you looking so sad? Hi, baby. Oh, you are lethargic. Yes, you are. It's okay. I don't want to hurt your baby. It's okay, Mama. Oh, yeah, this baby's gonna need fluids and stuff. She's dehydrated. So the calf is really dehydrated. I mean, I'm not sure why it hasn't been nursing, but before we even kind of get at the cause, we need to get at treating the symptom of dehydration because that's really dangerous in calves. What's wrong with baby, huh?
To give this calf a fighting chance, she needs fluids immediately. The quickest way is to use mom.
That's a girl.
So you're gonna try to
We're gonna pin her. Okay, there we go. Oh, come on. You
But
just
this reindeer isn't used to being handled.
settle down for a second. Even though we're like holding her and trying to help the baby, she's just like squirming and trying to get away. Okay, so bring the baby over. Stop.
Can you get in there?
Okay, try that, Maya.
Oh, there. Look at that. Right there.
No, you don't. Don't you dare kick that baby. There you are. Come on. I think she's just too weak. Watch the baby. Come on. I think she's just too weak.
A reindeer calf, just a week old, is dangerously dehydrated.
Watch the baby.
They desperately need her to nurse.
All right, we'll do it a different way. We've got to get her rehydrated. We're not getting her to nurse. So, you know, we're gonna have to get in there. We're gonna have to give her IV fluids. We've got to give her some pain meds. We've kind of really got to give her some intensive care or she's not gonna survive this. I know.
It's okay, Mama.
So now I can kind of try to do more of an exam, look at her color, looks good. She's really dehydrated. You can see when we pull her skin, it just stays all tented up and her mouth's kind of dry. And dehydration is very dangerous for these guys.
A check of the calf's breathing reveals a critical clue.
We've had some raspy lungs on the late calves that were born real late in the season, and she's one of them.
Yeah, she's raspy. You can actually see her breathing patterns kind of like...
Yeah. You know, she was up yesterday with us, and she doesn't really have a fever.
I think it probably is a virus. Like, I think something's starting it.
To fight off a potential infection, this calf needs strength.
Ooh, look at all those feet.
A dose of mother's milk, straight to the gut through a feeding tube, should help.
Okay, look at. I'm just trying to get the tube in to the right spot. I just need someone to hold her so I can like feel the tube. There we go. Okay, just hold still. Look, we're almost there. It's really hard to balance like handling and treating these babies because the handling can be really stressful for them when they're already feeling sick. But you gotta get in there and do something. Okay, so I gave her about half this, so about 25 mils.
The last line of defense, an antibiotic injection.
That's an antibiotic that's specifically for respiratory infections in calves, so it's a good one.
And oxygen to help her labored breathing.
So we're gonna let that roll for a while. Now we just have to give time and hope that some of these treatments are gonna kick in, but this looks pretty rough. And Maya's on it though. She's doing what she can to keep her comfortable and supported.
Michelle's work is just beginning.
What are we doing now?
This is my little bit more on the wild side herd.
Sounds like it.
We haven't really had hands on them since March. It's been about March, yeah.
So we're gonna run this group of animals through the chute. Here comes. Okay. A lot of them need their vaccines.
756.
They need some health checks. I'm coming in back here. And some of the females who haven't calved yet, we want to check and see if they're about to. So we're gonna do an udder check. There's no udder on her. The udder is utterly empty.
Let him go.
Utterly nothing.
Restraining an agitated 200-pound animal is dangerous work.
Hello.
855.
Definitely has an udder.
Whoa, whoa, whoa. You okay?
Yeah. These reindeer are domesticated and used to people, but you know, when we're trying to get them to do things that they don't want to do, like come through the chute, they get a little riled up. It gets rowdy.
Oh boy! Oh.
Two of the reindeer are trying to like shoot through at once. I guess they figured if they both came at us, we couldn't catch them both.
Oh! Let her go.
No! Yeah, I guess that's a bit of a reindeer game. Trying to send two at once and get on past us. That was pretty smart. Dang!
Double barrel shoot.
As the run through the gauntlet continues, there's good news in the next pen.
He's nursing? He's nursing. She was letting him?
For a second. Come on.
I hate to get excited.
Yeah.
I hate to get my hopes up.
I know.
The calf just was trying to nurse, so. Oh, look at him! Look at him!
He's running
with her. It just tried with her.
gosh.
Seeing the change in the baby, I mean, she jumped up. She's trying to nurse. That's awesome. So that's given me some hope. Sometimes all they need are IV fluids to like perk them up and get them moving. And if you can get them back on their feet and nursing, you can turn this whole thing around.
While Maya continues to stand watch over the baby,
Oh, for frick's sakes.
Michelle gets back to the herd. And next up,
And he's almost out of the squeeze.
a feisty male in need of some antler attention.
Yeah. It's broken here, so maybe that's where it started. So this guy's got a bit of an icky antler. A lot of times when they're growing and they bump them, they can actually fracture that kind of soft cartilage underneath. And then if you get any kind of cuts or fractures in there, it's likely to get infected.
If left to fester, the infection could spread.
We're gonna go up above that fractured tissue and with some giggly wire, just cut it off. But the downside of doing that is that these antlers are growing like crazy and they have a huge blood supply and they will often bleed quite a bit. We'll see how good we can get the tourniquet on.
A tightly tied tourniquet will hopefully keep the bleeding under control.
I know, dude. It's about to get bloody. Okay.
Get it.
Not even a spray yet. I don't think there's gonna be one. So with that good tourniquet we put on, we didn't get any bleeding, which is kind of awesome. It's nicer for him, and Denise will remove that tourniquet probably tomorrow or the next day. Sorry about that, buddy. Okay, you can go.
Okay.
Mom, you want to come help me resituate her?
Across the pen, Maya's calf has taken another turn. This time, for the worse. The fluids and pain meds were only a temporary boost.
It was just too much for a little sick baby.
Yeah, that's no good, hey? No good.
After its little run, I thought maybe it's just exhausted, but it can't lift its head anymore, and I can tell that it's in a lot of pain. Apparently, they crash really hard, and I think that's what she's doing. You want to try and get up?
So just checking in on the reindeer, Maya said it's been grinding its teeth. If they grind their teeth, that means they're in pain.
Yes.
It's like doing worse and worse. She's miserable. But her respiratory effort is pronounced. Like she's kind of like she really is working at it, and it probably hurts every time she breathes. You know, she went like this, and then she's basically just gone like this. But we're gonna still go ahead and try and give her some milk, give her some fluids, keep giving her IV. Watch she doesn't jump on me. If this continues, though, I have to consider that she's also suffering, and I'm just prolonging it. Oh, God, you poor thing.
A week-old reindeer calf is fighting to survive. After Dr. Oakley's best efforts to revive her, the outlook is grim.
It's tough when you get these sick babies in because they're so sad looking and you're trying to help them along. You get attached. And I mean, even for Maya, I know it's hard for her because sitting with it all day and hoping you see improvements and seeing it go downhill. Maya came to me and she said, Mom, it's not doing well. Like, you know, it was hurting her to see it in pain. Okay, well, I'm gonna go talk to Denise. She looks pretty...
Not good, huh?
She looks a little rough.
Yeah.
Yeah, like she kind of perked up for a bit, but she's gone way downhill again. So I just gave her another 35, but she's still like kind of grinding her teeth and uncomfortable and just sad. So I think maybe we should just put her down.
Okay.
It's the news Denise was desperately hoping she wouldn't get.
I totally trust Dr. Oakley. She was honest with me, and we agreed that it was time to go ahead and euthanize the calf.
I mean, unless you've seen where they come around.
I've not had one make it after this starts. The newborn calves are so special because they are, they're the continuation of our herd, first of all. But secondly, the bond that they have with their mothers is so important and so special. And so I feel bad for this mom today.
Oh, my little baby, I'm so sorry. We couldn't figure you out. We're gonna you know, take away her discomfort, and we're gonna let her go easily. And I was so glad that we were here, not only to ease its pain a little bit, but then to finally end its suffering.
Sorry, Mommy.
Across the pen, the work must go on. The final few patients make their way through the reindeer gauntlet.
Oh, dude.
Push her out.
Last baby. Here it comes.
And they save the best for last.
Last one.
Woohoo!
We did
And it's
it.
a baby.
Yes.
Nice to end on a baby note. Oh, nice catch. Yeah.
956.
Okay, baby.
Oh, 2 shots at one time.
Yep, double barrels.
It's like when you get your ears pierced.
Yeah.
Go. Ready, Maya?
Yay! Woohoo! Another handling done.
Wow.
As a new morning dawns, Michelle continues her trek through the wilderness, headed to the Alaska Wildlife Conservation Center to check on Clark the moose. When he last saw Michelle, a mysterious respiratory infection left him struggling to breathe.
There's a big difference.
Yeah.
Right to left.
Clark's blood was sent to a lab. Now, there are answers.
So Clark's blood results told us that he's had a type of bacterial pneumonia and some deficiencies in copper and a few minerals. And mineral deficiencies can definitely make it difficult for the immune system to fight off any infection. Without that information, it would have been hard for us to know how to treat Clark, and it actually really helped us figure out what the best antibiotic treatment would be.
So far, the treatment seems to be working.
Wow, Clark looks really good.
Yeah, we still want him to add some weight, but otherwise the coughing and the nose drippies, those have kind of disappeared.
Yes.
Clark's just been having a heyday. He's been out getting browse every day, and he's looking really good. He's not coughing anymore. He's still kind of a little guy, but he went through a lot this last winter.
He looks good, and he's been pretty active running around.
Yep.
Cool.
Comes up for browse.
Because sometimes they won't cough until they start running around, so if you're not seeing it even then, that's an excellent sign.
Cool, yeah.
Great.
Clark's miraculous recovery is proof of the power of teamwork.
With the help of the pathologist, Dr. Burek, and with all of us kind of looking at all the different results, I feel like we finally figured it out. We're improving his mineral intake. We're improving the type of antibiotics we've been giving him. I expect Clark to put on a lot of weight and just improve to run around and be happy. Well, good stuff.
Yeah.
Glad to hear it.
Back at home base in Haines, Alaska, Michelle and her daughters are on deck for one last patient.
Archer! Hi, buddy!
Hi. 3 months ago, 4-year-old Archer underwent a complex surgery to repair his eyelid that was severely scarred and unable to close.
His eyelid closes.
Oh, Archer, I'm so excited for you, buddy.
Today, he's back for a follow-up.
Hi! How's it going? Archer, is that his eyebrow? Oh! Oh my gosh, he has old man eyebrows. What? I literally LOL'd when I saw that eyebrow. It's so bushy, it looks like a bunch of feathers stuck there. Your eye looks so much better, and the eyebrow is amazing. This looks like you glued this on. That actually is growing, right? You didn't put that there? Yeah. Because this is literally a joke that I would pull on somebody. That is your new eyebrow, as beautiful as it is.
Cosmetics aside, Archer's eyelid is now functioning as it should, and without pain.
The good news is his eye is not as retracted and he can blink it easily on his own. And that's probably a scar, and it'll continue to get smaller. That's about it. He just looks amazing. Archer has gone from literally 60% of the skin on his body being burned and exposed in a wound, and now down to well under 1%. He has now just this kind of 2-inch opening that is continuing to heal. So overall, he is completely comfortable, and he is back to the old Archer. I gotta give you some treats. One more little bit of treats. Good boy. Thank you for coming. Keep your eyebrows trimmed.